My name is Ramil Bhatnagar. I grew up in New York, in a suburb outside New York City. I went to college and medical school at Northwestern University. I was in what they call 7-year med program, which is called the Honors Program in Medical Education. So basically, out of high school, you're accepted in this position, and you have a guaranteed spot in med school. So I did 3 years undergraduate at Northwestern, and then I did 4 years at Northwestern University Medical School in Chicago. After medical school, I went to orthopedic surgery residency in Boston. I was there for 5 years, and then did a scoliosis and spine surgery fellowship at the Hospital for Special Surgery in New York. After I finished there, I came down to New Jersey, and I've been here at Orthopedic Institute of Central Jersey, now Orthopedic Institute Braille Orthopedics, for almost 20 years now. So my inspiration for orthopedic surgery was actually from an experience I had when I was younger. I had an orthopedic disease called Perthes disease, where it affected my hip. Basically, it's a disease where the blood supply to the hip joint is diminished, and it causes deformity of the hip joint, which is usually a ball and socket, and the ball collapses. So once it was diagnosed, I had to be on crutches and wear a brace for 2 years. And previous to that, I was very active in sports and things of that nature. So it really affected me. Through that time period, I had a good relationship with my orthopedic surgeon. I'd seen him every other month. I really explored into that particular disease and other orthopedic diseases. And I always told myself as a young kid, this was from 11 to 13, that one day I'd go into this field and hopefully find a cure for this disease, because not much was known about it back then. And even now, there's still not much known about what causes it, etc. So that was my first exposure to orthopedic surgery, and actually my motivation to go into it. So I cover spine trauma at the big trauma center here. So a lot of these patients come in and they're in motor vehicle accidents, have bad falls, and they have severe injuries with neurologic deficits that are catastrophic. So the one patient that I look back at, and look back at one of my best success stories, was a young patient, an 18-year-old woman who was involved in a beach accident at one of the local beaches, and she sustained a fracture and dislocation to her neck, in which she injured her spinal cord. And when you injure your spinal cord in your neck, you lose function of your arms and legs. So we're lucky to see her very early and diagnose her very early with x-rays, CAT scan, and then an MRI to look at what the issue was. And I was able to get her to the operating room pretty quickly. And fortunately, after decompressing her spinal cord and repairing the issue and restoring alignment and stability, she got pretty much a full recovery. So looking back, it happened somewhat early in my career, and looking back, it really was a success story that I look back on. Well, anytime a patient comes in, obviously they're there for a reason. So I'm trying to first understand what their chief complaint is, and then try and correlate that to their physical examination and their imaging studies. And we always try to put ourselves in their shoes. So in order for them to feel comfortable, I have to understand where they're coming from. And once I get that basis as to where they're coming from, then I could better counsel them as to treatment options and going forward from there. So my first step is always to see what brings them in to see me. The MRI shows certain things, our physical exam shows certain things, but they may not correlate to what the patient really cares most about and what brings them in. So that's really the first tenet for me, to gain an understanding of where they're coming from, and therefore a comfort level for the patient when they're dealing with me as a doctor.